The first time I read Pediatrics in Review, I was an intern, and I was doing my internship at the Navy Hospital in San Diego in Balboa. And so it was just crazy, right? Because we had so many patients we were seeing, and you had a journal that some other resident was reading, and you looked over and thought, what are they doing? Why are they looking at that? We're supposed to be taking care of these patients, and we're supposed to be putting IVs in and doing all the other things that are important. But then you saw them just reading it and then highlighting it with their yellow highlighter, underlining it, and then just sitting there and looking off in the distance. So what I remember doing is I remember stopping what I was doing and seeing what the supervising resident was looking at and said, what are you looking at? And they would say, oh, this is this new-ish journal. It wasn't that new, but it was new to us since we were interns and first and second year residents. And I remember thinking, ooh, that's a really good way of looking at this. And then what was really interesting is that I continued to read it, I would look at who wrote it. Because the farther along you get as a pediatrician, the more people you know in the world of pediatrics. So it almost becomes, you look at the title, interesting, and then you look at the author and go, oh my gosh, I know this person. So for me, I knew Dr. Breuner Stapleton, who wrote an issue on nephrolithiasis, or kidney stones. And I know him, and he's my boss, and it was my boss for the longest time, but I didn't know that when I first started reading this. And later on, in fact, today, I remember reading this issue before I'd even known Breuner. And so it's just such a great journal. And it's filled with information, and you can read it quickly, or you can take your time and read it. And one of the things that's really important to me is I also do integrative medicine and holistic medicine. And Pediatrics in Review has dedicated at least one article in every other issue to integrative medicine, and I've written a couple of those. And one of the things that's been really important to me in terms of what Pediatrics in Review has done for me as a clinician is it consolidates a lot of information into a review article, yes, but with up-to-date resources that you can look at as well when you're reading through it. And it has really helped me when I'm teaching a resident or a fellow or a medical student, and for example, taking care of a patient with an eating disorder. I kind of go through my mind and I think, let's see, can I come up with a review article? Can I think of something fast? And I think, Pediatrics in Review. Let's go in there and let's pull up the most recent article. And I'll pull it, print it, or I send the link to my resident or medical student or fellow, and send one of the links to myself as well. And look at it and think, I thought I knew all there was to know about this, and then you read it and you realize there's a few more things I don't know, which these authors have come up with and have really helped me as the farther along I've gotten in pediatrics. The more I think I know everything, and actually the less I know, because I don't know everything. And especially as a teacher of pediatrics, I need to make sure that I'm on top of it, I'm on my game. So I look to Pediatrics in Review to help me be a better teacher for the younger doctors that are coming forward. The teaching component is really important. And sometimes people don't know about this. They think it's just mostly an electronic or paper journal. But if you need help in coming up with teaching slides to help you teach, Pediatrics in Review has that for you already done. So all you have to do is click, download, and save it to your file or print and just use it as a template to teach. And then you don't have to go through hours and hours of putting together a slideshow because it's already done. And it's easy to access, and it's also easy to forward to someone else that might need to use it in their presentations as well.